Now, one of the you know major changes that's happening in the field is for us to stop treating myeloma like with a one-size-fits-all approach. And as Dr. Goodman already pointed out, we really have to think about how can we treat patients with high-risk myeloma in a different fashion. So one of the major differences that we have, or the changes that has been implemented in the setting of high-risk myeloma, has been to use 2 drugs for maintenance instead of just using 1 drug. So this is a trial that was done in Italy, where they looked at a combination of carfilzomib or kyprolis along with Revlimid for maintenance, and demonstrated that the 2 drugs is better than 1 drug in everyone, particularly in those patients with high-risk disease. The second important concept in the high-risk multiple myeloma has been this concept of sustained MRD negativity. So the question is, not only do we need to get them to that minimal residual disease negative stage, which essentially reflects a stage where we cannot detect any myeloma cells with even the most sensitive technique that we have available, and also keeping those people at that stage or that level of disease for long periods of time. That kind of a approach, or I should say that sustenance of that MRD negativity, seems to really decrease the risk that is associated with having high risk multiple myeloma. Now, whether every patient need to be there, or whether we can even give enough treatments to get every high risk patients to that point, is unclear.